Good afternoon and welcome to today's Downing Street coronavirus briefing. I'm joined remotely by Professor Stephen Powis, the National Medical Director of the NHS, and by Deputy Chief Medical Officer Professor Jonathan Van Tam. Before turning to progress on vaccines, I'd like to go through the latest data. The latest average number of new cases each day is now 22,287. And I'm glad to say that that is just down on the 24,430 a week ago. I want to thank everybody for doing their bit during this lockdown. And taken together with the Office for National Statistics survey that was published at lunchtime, these figures are promising and they show that the second peak is flattening. But we must keep our resolve. There are today 16,409 COVID patients in hospital across the UK, and sadly, yesterday, 511 reported deaths. This is a virus that has cast a shadow over this incredibly difficult year. And we've always known that the best long-term answer will be the ray of light provided by a vaccine. After clean water, vaccines are the most effective public health intervention that has ever been devised by mankind. They are how we eradicated smallpox and how we're on the brink of eliminating polio. And each winter, they help our NHS stand firm against flu. Already this year, we've vaccinated more than 12 million people, a record number for this time of year. And because I took the decision earlier this year to double the order of flu jabs, I can now announce that we're rolling out free flu jabs in England to all over 50s from the 1st of December. A reminder, your GP will contact you. You don't need to call them. And I want to thank all GPs and pharmacists for the role that they'll play in rolling out the flu jab, this record scale of flu vaccination program this year. And this winter, of all winters, it's important that you get your jab, because catching flu and COVID together is very dangerous. I urge anyone who is eligible for a flu jab to get one, to protect you, to protect your loved ones, and to support the NHS. Right from the start, we've thrown everything we've got at the global search for a vaccine against COVID. The best scientific brains from all around the world have been working together on a solution. And the UK has funded more international support than any other country of any size. We should be very proud in this country of the part that we've played to find a vaccine for all of humanity. There are now many promising vaccine candidates going through clinical trials. And over the past few weeks, we've seen encouraging results from phase 3 trials from Moderna and Pfizer-BioNTech, and from the phase 2 trials of the AstraZeneca-Oxford vaccine. And today we have more positive news. Pfizer-BioNTech announced this morning that it has submitted for emergency use authorization from the FDA, based on phase 3 data, which shows the vaccine is 95% effective with no serious safety concerns. Here in the UK, the first step of authorizing a vaccine is for the government formally to ask the independent regulator, the Medicines and Healthcare Products Regulatory Agency, or MHRA as it's known, to assess its suitability. The MHRA, which acts for the entire UK, is one of the world's most respected regulators. And I can confirm that the government has formally asked the MHRA to assess the Pfizer-BioNTech vaccine for its suitability for authorization. Pfizer-BioNTech have already begun supplying data to the MHRA and will submit their full data in the coming days. I want to stress that the MHRA is rigorously independent and any questions around their process are entirely for them. This is another important step forward in tackling this pandemic. If a vaccine is approved, it will of course be available across the UK from our NHS, free at the point of delivery, according to need, not ability to pay. We've procured vaccines on behalf of all parts of our country, and I'm working with the devolved administrations to ensure it's deployed fairly to all across the UK. We'll prioritise groups who are at greatest risk based on advice from the Joint Committee on Vaccinations and Immunisations. And it's worth saying this, the rollout will be a massive logistical challenge, but I know that the NHS can do it, not least because they deliver the flu vaccine programme each year. And the NHS is in the process of establishing vaccination centres across the country that can manage the logistical challenge of needing to store the Pfizer-BioNTech vaccine at -70 degrees. In addition, it is establishing vaccination hubs in hospitals for NHS staff. These two routes are likely to comprise the bulk of the campaign this side of the new year. Then there will be a community rollout involving GPs and pharmacists. Last week, we asked GPs to sign up to deliver local services, and I'm really grateful that so many are coming forward. Our approach with these 3 delivery models, community teams, vaccination sites, and hospital hubs, this has been devised to be flexible and to reach all parts of the country. And I want to thank in advance this huge team, the organisers, the vaccinators themselves, and all of the admin and logistical staff who are going to be working so hard to make this happen. I know everyone wants to know about the timing and the speed of the rollout. That will depend on the speed at which the vaccines can be manufactured. We know that the manufacturing process for all vaccines is difficult and uncertain. So I've asked the NHS to be ready to deploy at the speed at which the vaccine can be produced. What I can say about timing is that if, and it still is an if the regulator approves a vaccine, we will be ready to start the vaccination next month with the bulk of the rollout in the new year. We're heading in the right direction, but there is still a long way to go. Coronavirus remains a grave danger right now. So we must all keep doing the things that we know blunt the force of this lethal virus. Hands, face and space, and if you have symptoms, get a test. And help keep everyone safe until the science can help to see us through to the other side. I'm now going to hand over to Professor Powis to take us through the data. Professor Powis.
Thank you, Secretary of State. And today I only want to show a single slide, and that is a slide that I've shown you previously concerning hospital inpatients in England. As you know, and as we have said before, as infection rates rise in the community, unfortunately, the number of people getting sick rises, and for those who are the sickest and need inpatient hospital care, clearly that means admissions into hospital rise too, and the overall number of patients with COVID in hospital. And you can see that as we went from a low point in August, infections in the community have been rising through September, October and November, and that has meant that the number of patients in England has risen. You will see that it stands now at 14,479. And when I presented this slide 8 days ago at the press conference last Thursday, that was about 1,800 less. So we've seen a rise of around 1,800 in those 8 days. You will see from this slide that in the last few days, right at the very right end of the graph, there looks as if there is a leveling off. So that is just a few days data, and it's important not to read too much into it yet. We need to see data over a few more days and into next week. But again, as I've said before, it takes 2 weeks and beyond that before we see any effects of the reduction in infection rates in the community translating into a reduction in admissions and the number of inpatients. As the Secretary of State has said, we are starting to see evidence that as a result of restrictions, infection rates are falling. So it will be important over the next week or so to look at hospital data to see whether that translates, as we hope it will do, into a flattening and hopefully a reduction in the number of inpatients. We are not yet in winter. NHS gets busy as we get into December and into the first months of the new year. And it's really critical that we keep the number of patients with COVID in hospital down, because it's by doing that that the NHS can ensure that its services are up and running everywhere, that it can treat patients who have other conditions as well as all our COVID patients. And of course, all our staff are incredibly keen to ensure that we are getting through the unfortunate backlog of work that has resulted because of this pandemic. So I want to reiterate the importance of us all keeping to the advice, the restrictions that are put in place, because it is by doing that that we can best help the NHS to do the job that it always does, which is to provide care for all the citizens of this country. Thank you. Back to the Secretary of State.
Thanks very much to Professor Powis. And now we'll go to the first question. The first question is from members of the public. And we turn to Stephen from Weybridge. Stephen.
ONS stats show us that Black and Asian communities are disproportionately affected by COVID-19. They are 3 to 4 times more likely to die of COVID-19 than those of white ethnicity. As such, will these communities be given vaccine priority after NHS workers, the elderly, and those with pre-existing conditions?
Thanks, Stephen. This is an absolutely critical question, and one that the Joint Committee on Vaccinations and Immunisations that advises us on the clinical prioritisation for vaccines has looked at very carefully. And I'm going to turn to Professor Van Tam in a moment because he has been doing the work on this with them and talking to the Joint Committee on this question. But the overall assessment that they have come to so far, based on the information that they have and the interim analysis, which will be updated when the full data is available, is that the most important determining factor in your risk is your age, and of course the need to protect those who are in turn looking after the most vulnerable, the NHS staff and social care staff. And that's the assessment that the JCVI has come to. I'll ask Professor Van Tam now to set out more details.
Yes, thank you very much. There is really relatively little to add to the Secretary of State's answer. It is definitely something that JCVI have considered. It is definitely the case that far and away the biggest risk factor for the likelihood of a bad outcome from COVID-19 is age, followed by the presence of comorbidities, that is, chronic underlying illnesses that place you at higher risk. And we do know that a very significant proportion of the unfortunate but true signal we see in Black and minority ethnic groups is driven by the presence of comorbidities that occur at an earlier age. And because the JCVI is very clear already in its provisional priority list that it will be targeting people according to having underlying risk conditions, then they believe that that is the right approach. And I would support that and say that what is now really important is that the vaccine is accessible to all communities, irrespective of their ethnic background, and that people come forwards and that when they are called and the uptake is very high. These are going to be critically important things as we move into a new phase of actually being able to deliver a vaccine program in the early months of next year. Over.
Thank you very much, Professor Van Tam. Now we turn to Claire from Birmingham. And Claire's question is, I'm a single parent family who works full-time as a key worker and I will not be paid by my employer. What support is there for working families whose children have to isolate? Thank you, Claire. Another incredibly important question. And we have put in place a system of support so that if you have to isolate and you are eligible for benefits and universal credit, then you can access a £500 support payment for the period that you have to isolate for. And I know that many thousands of people have benefited from that support and that payment so that they can do the right thing, because the self-isolation that's required when you either test positive or a close contact is such an important part of stopping the spread of this virus. Thank you, Claire, for your question. Now we'll turn to Hugh Pym from the BBC.
Thank you very much, Secretary of State. How strict will restrictions have to be in England after December the 2nd, and over how many days might there be some relaxation during the Christmas season?
Thanks, Hugh. We're doing the work on what happens after December the 2nd right now. It's still too early to tell, although we can see from the data out in the last couple of days and also from the ONS survey out today that this is clearly flattening. The peak is clearly, we're clearly near the peak of this second increase and the second wave. So what I'd say is I'm afraid we still haven't made those decisions. Over Christmas, I know how important it is for people that we have a system in place, a set of rules that both keeps people safe, but also allows people to see their loved ones. And many people have family in different parts of the UK, so we're working with the UK government and the 3 devolved administrations to try to have a consistent set of rules across all 4 nations so that it's easier for people to travel and to see their loved ones. But there will have to be rules in place because we still want to, obviously, we want to keep people safe as well.
Can I ask a follow-up to
Yes, please do.
Tom and Steve Powis on this? I mean, how worried are you both, or one of you, how worried are you about a lifting too much and resulting in too much pressure on the NHS going through January?
Well, maybe Professor Powis can answer that question.
Yeah, thank you, Hugh. And clearly, as I said, it's important for the NHS that we get infection rates down, because then we can take pressure off NHS services as we go into the NHS winter in December and onwards. So as I've said previously, the government will be lifting the current restrictions on December the 2nd, but I am sure we will not be going back to normal. Further restrictions will be required. It's important for us that we see numbers of admissions stay down. The public once again has responded this time round as it did in the spring. We want to ensure that we keep those gains and we keep the pressure off the NHS. But as is quite right, the decisions as to which particular measures need to be in place needs to be a decision for our elected representatives, based, of course, on the data analysis and what the figures are showing us.
Thanks very much. The next question from Thomas Clark at ITV. Tom.
Thank you, Secretary of State. As you say, the numbers from the ONS survey today do show the outbreak levelling off on average across the country. But in London, the southeast, the east of England, the numbers are still going up. It does beg the question, although it's early days, for the lockdown impact. Does the outbreak have to be flat or falling in all areas for us to safely ease lockdown restrictions before Christmas?
Well, Tom, I very much hope that the numbers will start to fall. We've seen that levelling off that you describe. We've seen the change in trajectory in all parts of the country, in all parts of England, I should say. We watch each day's data vigilantly. We're just at the point where we're starting to be able to get a picture of that flattening, which is clearly good news. But obviously, I want to see that starting to come down. It might be Professor Van Tam might be able to add something to this in terms of expectations, because I try very much to look at the data that we are seeing and the data that's reported, and look at that each day rather than trying to make projections myself.
Yes, thank you, Tom. I'm sorry I can't be with you personally. I'm actually self-isolating at the moment due to a household contact. You're quite right in the way that you interpret the latest ONS data, but they are from the weeks 8th to the 14th of November. So they are a few days behind where we are now. And it could well be that these other regions will also, the ones you have pointed out, currently having increased positivity, will turn. I would expect them to turn, but we have to see that in the data. What I would say is that overall, clearly it is an improving picture. These are very early signs that the epidemic is beginning to level, but we should be cautious about interpreting that. And, please everyone remember that it just takes a few seconds to create new infections through unneeded close contact. Those infections become disease, become illness, typically 5 to 7 days later, and then they become hospitalizations another 7 days after that. So, you could lose this in just a few seconds. And we're not at the end of the prescribed lockdown period at the moment. Every single one of us has to keep up the pressure on this virus and push down on it as much as we can right to the end of the period. Bearing in mind that when we get to the end of that period, actually we see the fruits of our actions a few days, a couple of weeks later. And this is really important. Don't give up on it now. Thank you. Over.
Thanks very much, Tom. The next question from Ben Kentish at LBC.
Thank you, Secretary of State. I wanted to follow up on Hugh's question, because Sage say that for any day of easing of restrictions over Christmas, we'll need 5 of tougher restrictions to make up for it. Today, we heard that any easing over Christmas could lead to tens of thousands, more deaths. That likely means more cases. That likely means hundreds more deaths. As Health Secretary, do you believe any easing of restrictions just for Christmas is worth it, given the huge costs involved? And if I could just ask you a second question, Health Secretary, many people watching this would have experienced bullying in the workplace, and they might have hesitant to come forward because of a fear that people in powerful positions simply get away with it. What would your message to them be today? And just very, very quickly to Professor Van Tam, Professor, if you could say in percentage terms now what you believe the chances are of a vaccine being deployed in the UK this year, would you be able to put a figure on that? Thank you very much.
Well, thank you. Thanks for those 3 questions, Ben. If I take the first one first, and then I'll ask Jonathan Van Tam to come in. When it comes to Christmas, I understand that as the most important holiday in our year, what an emotional attachment people have to seeing their family over Christmas. Of course I do. And so we are looking for ways to allow that to happen, but also in a way that is safe. The question of how quickly the virus recedes when it's gone up depends on what you get the R down to. So there isn't a fixed figure. The question is the action that we take. And we also have the much expanded mass testing that's available now. But we are going to take of course we're going to take an approach that keeps people safe, as well as recognising the importance of Christmas and the importance of seeing our loved ones over Christmas. On the question you asked about the Home Secretary, the Prime Minister's made his statement. The Home Secretary has apologised for the upset caused, and I think what I would say is I think it's incredibly important that everybody is treated with respect in all circumstances. If I ask JVT to answer the third of your questions.
Thank you, Secretary of State. I think I'll just add a little bit of colour to the question about Christmas first and say, look, the government clearly wants to give us a break to some extent at Christmas. We as citizens all want something of a break. But there are no magic numbers about, you know, one day of Christmas, N days of payback in terms of lockdown. It's partly about the proportionate measures that the government will take in allowing us to have a sensible Christmas. But it's also about whether we comply and whether we follow the rules that are then put in place for that period. And if people don't, then the first scientific principle is that things will go back up again. And that's really, I think, the key message, that there's a dual responsibility here, and there's no magic number about how many days this is going to cost us. So we shouldn't frame it that way. On your second question about certainty about vaccines before Christmas, we do have a certain readout on the Pfizer-BioNTech vaccine, which we have contracted to obtain for the British people. We are waiting the MHRA authorization, or at least consideration of whether it can authorize the vaccine. That is a matter for the MHRA that I'm not going to speculate on, and it will happen at the speed of science. It has to happen in their own time when they are ready, and we need to leave them and trust them to get on with that. We don't know numbers of vaccines. That's of course always in the hands of the manufacturers about what they can produce, and it's in the hands of the manufacturers and the regulatory agencies around how quickly batches can be released for use if they are authorized. And it's pointless us speculating on that at this point in time. But do I believe that we are now on the glide path to landing this plane? Yes, I think I do. Do I accept that sometimes when you're on the glide path, you can have a side wind, and that the landing is not, you know, totally straightforward, totally textbook? Of course. And this is the real science world that we live in. But yes, I think we're on the glide path. Over.
Thank you very much. Next question is from Chris Smith at the Times. Chris.
Thank you. Now, I know you've said that vaccinations people were dependent on supply, but can you confirm that the Plans and Health Service Journal today that if the supply is there, it will be possible to vaccinate every adult who wants it by April? And those plans suggested that all vulnerable groups would be vaccinated by the end of February. And if so, would that mean that by March, obviously the pandemic would not be over, that you would see a reduction of hospitalizations that would mean there would therefore be no need for restrictions specifically to protect the NHS anymore?
Well, it's a very important question. There are all the uncertainties that Professor Van Tam's just set out. The task of the NHS is to ensure that as fast as the vaccine can be manufactured, so it can then be deployed. And I'll turn to Professor Powis to set out some of the details of that, because the NHS is taking the lead in the deployment of the vaccine. But what I'd say about the questions of timing is that the uncertainty is over the regulatory authorization, because the regulator will only allow the vaccine to be deployed if it is safe, and then over the manufacturing and the speed at which any vaccine can be manufactured. And of course, in particular, the two leading vaccines, the Pfizer-BioNTech and then the AstraZeneca-Oxford vaccines as the two leading candidates. However, we are ensuring that we're ready to deploy, should all of that go right, from next month. But I would caution that the bulk of the rollout will be in the new year, even on the best case scenario. And it will take a few months to get that vaccination program through for the vulnerable groups, if the vulnerable groups stay as currently set out by the guidance from the JCVI. Professor Powis.
Yes, thank you, Secretary of State, and thank you, Chris. So I think the slides that you're referring to are from a number of weeks ago, and they are already up to date, already out of date. because we are continually getting new information from the clinical trials, from the manufacturers in terms of what they are able to produce. So in the NHS, our job has been to plan for a number of different eventualities. And we will not be clear exactly how we will be deploying this until a few steps have been taken. And both Professor Van Tam and the Secretary of State have outlined those steps. We don't have an authorized vaccine yet. So firstly, we need the information from the clinical trials. And as you've heard, Pfizer have deposited that with the FDA today and should be shortly doing that with MHRA. So MHRA, as a regulator, have to consider that data. JCVI have to then recommend, assuming it's authorized, the prioritization for who gets vaccine in which order according to risk. And we need information from the manufacturers on what they can manufacture. They're obviously stepping up manufacturing in an unprecedented effort to increase vaccine supply. There's likely to be more than one vaccine coming. And of course, as Jonathan has said, there will be bumps along the way in terms of all these processes. So we are planning for all eventualities. And again, through routes that we take for vaccination already every year through our GPs, through our community pharmacies, through our hospitals, but also through vaccination centres. We, like everybody else, want to get the vaccine out as quickly as possible. We don't underestimate the scale of the challenge. It's a huge challenge, but I, like the Secretary of State, are confident that we will be able to deliver that for the British public, but it will take into next year and it will take a number of months. Whilst we're doing that, it's important that we still, as citizens, comply with the restrictions that are in place now and might be in place for future, because we will have a tough winter ahead. And we need to do all these things to battle this pandemic and get through.
Thanks. Thank you very much, Steve. And the Chief Medical Officer has said in the past, Chris Whitty has said that he hopes that we'll be able to get back more towards normal by the spring. And with this news we've had over the last few weeks and with the expansion of mass testing, I'm more and more confident that he's right. If we go to Jack Blanchard at Politico.
Hi, thanks very much. Secretary of State and the others, you'll be aware of the scale of misinformation out there about vaccines and the supposed dangers of them. How are you going to combat that over the next few weeks? And how concerned are you that take-up won't be high enough, assuming these vaccines are approved? And is there a percentage of the population that we need to take this so the virus is actually defeated next year? And just on Priti Patel, if I may, just for you, Secretary of State, what is the point in having an independent advisor on ministerial standards if the Prime Minister is just going to ignore that advice when it's one of his mates in the firing line?
Well, I've answered the question on the Home Secretary, and the Prime Minister has been clear that he doesn't think that the Home Secretary has broken the ministerial code. On the substantive question about the vaccine, I'll turn to Jonathan Van Tam in a second, because he's been very clear about the best way to explain to people the benefits of having a vaccine, and all of mainstream science supports the use of vaccines where they're safe, and the safety can be assured by the fact that that no vaccine will be rolled out unless it's signed off by the regulator, which is independent. But the thing I'd say about the way that we discuss this is that there's a huge amount of work that has gone on and is going on in terms of ensuring that the objective, factual information about a vaccine is made available, and to ensure that that is the information that people can have access to, rather than things that aren't true and scare stories that are put about. But the best way to reassure people is not for people like me to talk about it, but it's for those who are the real experts and the clinicians, like Professor Van Tam. Jonathan.
Thank you, Secretary of State. So, Jack, I'm not sure if you saw my briefing of a while ago, which I did with Professor Rain from the MHRA. And the MHRA were very clear that there is absolutely no difference in terms of the rigor and the standards they will apply to COVID-19 vaccines as to any other before they authorize them. And I was very clear that I'll be very happy with their authorization and very happy, indeed eager to take a vaccine myself, and will be telling my mum to do so. And that, I think, is a really important message. On vaccine misinformation, I just don't propose to give it any airtime because it is just that, misinformation. And judging by the correspondence I've had from members of the public in the last couple of weeks, it is clear that there is much more anxiety about when vaccines will be available and where people are on the priority list. And I understand that anxiety. And what I would say is if we can obtain the vaccines at the scale which is reflected in our ambition, and if the NHS delivers them in accordance with the challenge set down by the Secretary of State, that the only thing that will hold us back is supply, then in actual fact, people shouldn't worry too much about where they are on a priority order, because the difference between being, this level versus that level will be 1 or 2 or 3 weeks. It won't be very long at all, because we intend to move with as much pace as we can possibly muster. Over.
Thank you very much, Professor Van Tam. I'd just add one further thing, Jack, which is that on the international studies that look at people's enthusiasm for vaccines in different parts of the world, the UK ranks quite near the top. Now, of course, I'd like that to be higher still, but we should have we should have confidence in our scientists and our clinicians that given the thousands of people that these vaccines have already been trialled on.
Is there a percentage we need for take-up?
In terms of a take-up percentage, the honest answer to that is we don't know. I'm asked this question all the time, and the reason that we don't know is that in the trials they can test and measure how effective a vaccine is at protecting an individual, but what they can't measure is how much it reduces the transmission. And until we know that, which we'll only know once we've rolled it out at scale, we then won't know the impact of the vaccine on R, and therefore won't know how big a proportion of the population you need to have vaccinated in order for it to end the pandemic. What we will know is that it will protect, in the case of the Pfizer vaccine, 95% of people over the time period that it's been measured. We don't know how long that protection lasts for, so we'll have to stay vigilant to all of these things and keep measuring the impact. But the good news is that we've seen over the last 2 weeks some really very promising results, both from the Pfizer-BioNTech vaccine and from the AstraZeneca-Oxford vaccine, and that means we're now able to plan with increasing confidence this rollout by the NHS. Thanks, Jack. Finally, Will James from Reuters.
Hi, thank you. Secretary of State, I wondered if you could tell us what assurances you've been given by the medicines regulator about how long their process might take. Is it something we could expect a decision from next week or the week after? Secondly, also, you've talked a lot about the importance of Christmas. It's clearly a holiday that you enjoy too. What are your plans?
Well, my plans at the moment are to have a small family Christmas, maybe with my father-in-law who lives on his own and is in our family bubble. That would be allowed under the existing rules. And I'm very respectful of the work going on, which is being led by others to see if we can get a UK-wide approach. So that's why I'm reluctant to comment any more on what the Christmas arrangements might be, because I just think it would be such a boost to the whole of the UK if the 4 nations, each responsible for healthcare in a devolved way, can come together and agree a set of arrangements that's both both safe and careful and sensible, but also allows families to see each other at Christmas. On the MHRA question, it is absolutely a question for them how long they take. I am not going to prejudge that at all. And in fact, I took the trouble in the opening statement to say that questions around their process are entirely for them. I hope you'll respect that because I don't want to even give any impression of trying to impinge on their independence. It wouldn't work anyway, even if I tried. And so I can't answer that question. But what I can do is say that given the Pfizer-BioNTech application in the United States to the FDA, that has given us the confidence, and with their data releases over the last few days, that has given us the confidence formally to start the process here, which by law first requires the government to ask the MHRA to consider an authorization, and I'm delighted that we've been able to announce that today. Thanks, Will. Thanks all for the questions, members of the public, members of the press. Thank you for Professor Van Tam and Professor Powis for so ably fielding questions virtually. And that concludes today's coronavirus briefing.